This is the supplemental audio for the infant phototherapy monitor delivered by IGH. The infant phototherapy monitor, also known as light treatment, measures the amount of light a baby receives during phototherapy. Phototherapy is a non-invasive treatment that uses blue ultraviolet light to treat skin conditions and jaundice in newborns. Jaundice is the medical term for a yellow-tinged coloring of the skin, or mucous membranes, such as the thin inner lining of the eyes and mouth. Jaundice is not a disease, but rather a sign of an elevated blood bilirubin level. The medical term for this is hyperbilirubinemia. Neonatal phototherapy breaks down hyperbilirubinemia by exposing a baby's skin to a specific wavelength of light, typically blue-green, which alters the structure of bilirubin molecules, changing the structure of bilirubin in the baby's blood, converting them into water-soluble isomers that can easily be excreted by the body through urine and stool. This effectively lowers the bilirubin level in the blood. Thus, this process is called photo-oxidation. Additionally, there are two kinds of bilirubin, unconjugated and conjugated bilirubin. Both can cause jaundice. Generally, phototherapy is recommended for babies who are 24 hours or older, since jaundice is more common and severe in the first few days after birth. For infants younger than 24 hours, the doctors might be more cautious, as jaundice in this early period can sometimes be caused by different factors, like blood type conflictions or infections. The objectives of this training video is to understand the role of infant phototherapy monitors in treating neonatal jaundice, and to provide step-by-step instructions on how to properly set up the phototherapy equipment, position the infant, and adjust settings for safe and effective treatment. Using an infant phototherapy monitor involves a few key steps to ensure the baby receives the proper amount of light exposure while being kept safe. In today's audio, we will explain how to properly expose an infant to ultraviolet light. The first step being assessment. A healthcare provider will assess the baby's bilirubin levels through blood tests, usually through a heel prick, to determine if phototherapy is necessary. The second step is preparation. First, place the baby in a dedicated phototherapy unit or incubator. Then remove all clothing except for a diaper and apply protective eye shields to the baby. A third step is light exposure. Position the baby under the blue light source, ensuring maximum skin exposure. Regularly reposition the baby to expose different areas of skin to the light. The fourth is monitoring. Monitor the baby's temperature closely. Regularly check bilirubin levels through blood tests to assess treatment effectiveness, and observe any adverse reactions like skin rash or discomfort. The fifth is feeding. Encourage frequent feedings to help the baby eliminate bilirubin through stool. The sixth step is discontinuation. When the baby's bilirubin levels reach a safe range, the phototherapy can be discontinued. There can be some abnormal results. Abnormal results could include temperature instability, skin changes such as rash or irritation, bronze baby syndrome, which is a rare complication that causes a progressive greenish-brown discoloration of the skin, urine, and serum. This is usually in conjugated bilirubin. Next is behavioral changes. This can be persistent crying or signs of discomfort. Some important factors to consider. The first being wavelength. The effectiveness of phototherapy depends on using the optimal wavelength of light, which is typically within the blue-green spectrum. The second is skin exposure. To maximize treatment, the baby's skin should be exposed as much as possible to the light source. The final important factor to consider is monitoring bilirubin levels. Regular blood tests are necessary to monitor the baby's bilirubin levels and adjust the duration of phototherapy as needed. This training video has been recorded using Northeastern University's audio equipment and produced by Northeastern University.